There can be familial clustering of cancers. Patients may have familial disposition, which puts them at a higher risk of suffering from cancer as compared to general population. This happens due to defect in certain genes, which are passed down the generation. Essentially, all cancers, they occur due to mutations, that is, a change in the structure of the genes, which in turn leads to malfunctioning of the proteins which are encoded by these proteins. These malfunctioning proteins, they lead to defect in the cellular pathway or in the cellular functioning, and which causes abnormal cellular growth, which in turn is called as cancer. Not all of these mutations are inherited or they are passed down the family lines. The mutations which are passed down the family lines are called hereditary mutations. Now, to understand, each gene in our body has two functional copies, and for a cellular pathway to be defective, it needs both of these copies to be corrupted. This is called as Knudsen two-hit hypothesis. When one inherits a defective copy, only one further copy needs to be corrupted for the cellular pathway to be defective or go haywire, contrary to the two hits which would be required for a normal person. Now, the most common of the hereditary gene defects is BRCA, that is the breast cancer related gene, and which is a part of the hereditary breast and ovarian cancer syndrome. Now, the presence of a BRCA gene predisposes a woman to a significantly higher risk of breast and ovarian cancer. It also increases the risk of pancreatic cancers in both males and females. Now, in a patient who is BRCA positive, they have 40 to 70% risk of developing a breast cancer, which is significantly higher than the general population, which is somewhere around 1 in 10. If you have close family members, especially multiple and especially suffering from breast cancer at a younger age, you should always think of hereditary breast and ovarian cancer syndromes. You or they may have a gene which has caused them to have breast cancer at a much younger age and as a part of a familial cluster. It's important to test rather than worry. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.